Yeah, exactly. That's what I do. I don't know, this is probably about my 23rd or 24th one I've done.
Wow. Is it every other month?
Hello, welcome to Senior Connections. This is our monthly look at all kinds of topics relating to older adults in Muskegon County and issues that might concern them and their caregivers. The show is brought to you by Senior Resources, which is your local area agency on aging, serving Muskegon, Oceana, and Ottawa counties. And each month we come and talk about issues that are of interest to you and those around you, and we try to navigate what can sometimes be a confusing network of services for older adults and their caregivers. So nothing more appropriate than trying to navigate that than by bringing in a couple of phenomenal ladies from CALL-211 today, and because they are all about navigating services. So I want to welcome my guest, Stacey Gomez, who is the director of CALL-211, and call specialist extraordinaire Bonnie Pendell, and they're going to help us try to understand more about the 211 service, why you need to remember those 3 digits as much as possible, and what resources there are to help older adults. So welcome, ladies.
Thank you.
Thanks for joining. So we'll start to get to know a little bit about both of you, and then we'll delve into 211. So Stacey, tell us how long you've been with CALL-211.
This month is actually my 16th year that I have been working with the 211 program. So initially I was hired actually as an employee of Senior Resources, which we'll talk a little bit when we get to the history part of our agency, but hired to be the resource specialist for the Information and Assistance Department at Senior Resources. And so, yeah, this is
16 years. Wow, you started as a baby.
Yeah.
Right out of high school.
Thank you.
Bonnie, how about you? How long have you been with CALL?
I've almost 11 years.
Oh, wow.
I started in 2006 with Ottawa
Okay.
County as a person that came in for just 10 hours to 12 hours a week. And then shortly after, I mean, it was in April, and by September, we were united with Muskegon's 211. And so I moved across the bridge to Muskegon.
And we're happy to have you.
Yes.
So
That was a good thing.
let's start with, we'll do a kind of an overview. So the name of the agency is CALL-211, and CALL stands for Community Access Line of the Lakeshore. Right. So you'll hear we abbreviate it as CALL sometimes, or just 211 because 211 is national, but let's talk a little bit about that. People have known for a long time 911. 911 is what you use to call for emergencies. You get police, fire, that kind of thing. So, but I remember from before, I mean, that happened during my lifetime that 911 came into existence. I'm very familiar with 211, but give us some examples. When should people use 211? What's the difference between those?
Sure. So 211 is a comprehensive, which means all ages, information and referral program. So an individual would dial 211 when they are seeking help with a need that they might have, or a need that they know someone in their family, a friend, a church member has, maybe a concern about how to navigate services. So they may have been told, you know, I think you should apply at this agency and this agency for help, but the person has no familiarity with what that requires. So they may call if they need help with that navigating, and also just maybe needing someone to talk to about if the problem or concern they have is something that help may be out there for. And I think of that for support groups, access to mental health services, substance use treatment. We have all different kinds of information and services in this community that help individuals that go beyond socioeconomic need. Right. And so it really is a program, the 211 is a program for everyone, regardless of their age, what their question or concern is. There are no wrong questions. We're glad to talk with everyone, but the main distinction between 211 and 911 is that we are not a crisis number.
Non-emergency
We are
issues.
non-emergency issues. It may be a personal emergency, you know, if someone's facing a shut-off notice, or if they're needing help finding housing or are struggling. Maybe with a new diagnosis and looking for how to connect with other people. You know, that can be a personal crisis for sure. But yes, we are not.
But a fire, a medical emergency, you're still calling 911.
Yes, and we certainly, if
for some reason, someone has gotten a hold of us rather than 911, we will warm transfer that caller over, either to 911 or say to a crisis hotline if we have a caller who's suicidal. We will make sure that they connect, and we will be that connectivity piece for them to get them where they need to go.
So you mentioned you've been with 211 for 16 years. How long has 211 been around in our area and nationwide? Because it is a nationwide system.
It is, and I know that the first 211 was started in Atlanta, and I'm not quite sure of the year on that. For Muskegon, it has been since 2005, August of 2005, that we launched the 211 dialing code.
Okay.
So in our area, it's been a while.
But we had information and referral before that.
Yes.
So you mentioned, I think you mentioned, Bonnie, having been an employee of Senior Resources before. You were too, I believe.
Yes.
Weren't you? So,
yes.
So how some of that happened is that Senior Resources had information and assistance or information and referral for older adults, those 60 and over, that was being provided. I know that United Way had a long history of information and referral in general for things, and so I know that at some point Senior Resources took the lead on deciding that we should make it an official 211 service. Did that United Ways also came into some of that?
Yes, yeah, and in Muskegon, the way the service came about was that Senior Resources, United Way, the health system, which there were two at that time, and lots of other community foundation, the Muskegon Chronicle at that time, the Intermediate School District, all came together and decided as a community that they wanted to have one central database that could be available on the internet. So rather than different agencies coming up with their own directories and kind of reinventing that wheel each time and using staff time and resources from those agencies, which we as nonprofits often have limited funding, to kind of work together and to bring all of their current directories and whatever they were using to put them in one place. And so Senior Resources, through that process, I believe, won the bid to be the agency that would handle that website, which was called iHelp. And that is when I was hired at that point to then be the resource specialist for that website. And shortly after that, Dee Scott, the former director of Senior Resources then, and Susan Howell Stuck, who was the former director for CALL, worked towards having the 211 program. So it actually started kind of as that website and then moving to being a phone-based service, using that website as a backbone.
So that's a really great history for people to understand, that it's a really wonderful way for all these different organizations to come together. Couldn't have really done all of that before we had internet.
No.
I mean, that's why everybody had their own fractured systems, and there was lots of picking up the phone and calling other agencies and trying to help people that way, and that's one of the big changes. What other kind of changes have you seen in your time there?
Gosh, we have gone through several different software providers for the information and referral database, and we're going to be going through another one starting on April 1st, so that is a big change. We have seen an increase and decrease in access of services. So when the recession hit, and because it hit Michigan first, and I know Muskegon, being especially affected by that, our call volume really rose in 2008, late 2008, 2009, 2010, and we have seen a more steady decline in contacts from that. So as our contacts have decreased, different 211 centers, including ours, have been in the position of seeing how else can we collaborate? What other kinds of programs can we work with? What screenings can we do? How can we assist other entities in work that they're doing and collaborate that way? So we have been involved, some examples of that would be in disaster assistance and being available to help counties, their emergency management departments, and fielding those types of calls. And just trying to make sure that we're helping not only individuals who contact us every day, but the larger community, and trying to be a good partner.
Really being an asset to
Yeah.
the whole community
Yes.
that way. So,
Yes.
Well, great. We'll come back to some more of that, but I want to hear from Bonnie. So, Bonnie, you're on the phone. What type of questions do you ask when somebody calls? Is there a typical call? Well, I know there's not a typical caller, but what kind of questions do you ask? And
Sure. When we first initially say, I identify myself as a CALL-211, Bonnie speaking, so that they know who they're talking to. And how can I help you? And that's just the lead-in to whatever the call may be taking us to. And depending on their response, I will then ask questions for utility help. You know, do you have a shut-off notice? Or, you know, maybe there's, is it gas, is it electricity, or both? Or, you know, we also always ask and try to identify the person's age, if we can, to determine whether it's a senior caller, and if they are a veteran or there's a veteran in the house. Those are two questions that can help us navigate into other resources that might benefit the caller at that time. Children, do they have small children? Some of our questions that we initially ask, or maybe not right away, but throughout the call, we get information that would identify other needs in the home, like children under the age of 5, whether they need WIC assistance or other programs and services, preschool assistance. So we identify some of their needs, you know, where they are, and see if there's anything that we can navigate into further on in the call, other than just the initial call, maybe for utility help. So after that, I guess it's just, okay, is your electricity, your gas, is it on, is it off? A veteran has more asset, you know, a bit assets, and that's not the right word, options, thank you, that might assist them. And seniors, also there's gatekeeper programs for seniors if they have tried to get help with utility help. There would be a gatekeepers program, maybe through Senior Resources, that can further help them connect with services. Sometimes they have already connected with the utility company, or not the utility company, but the agencies that are helping in the area, and they're not able to get assistance. So the Gatekeepers program might be able to help navigate, or at least extend the shut-off period so that they're not turned off right away, and they can do advocacy on behalf of the senior. So those questions that we ask are really are very helpful as far as determining what the needs of the caller are.
So you're not prying, you're trying to find out what services there are that can help.
Yes. And if they want to be anonymous, we don't push them.
That was going to be my next question. Must they give you their name?
No, they do not have to give a name. The only thing that we require is that they give us their zip code, so that we know what area to search in. You know, if they're in Ottawa County, we do not want to send them to Oceana or Muskegon.
So I'm just curious, does anybody ask you why you're asking them those questions? If you ask their age, because sometimes people are sensitive even though you're on the phone and they can't see you.
Yes, they do. And we give them the honest answer that it's beneficial to us in order to help them, you know, identify whether they're seniors or not. And it's also information that the next time that they call, the next call specialist can build on the information that is given to them. It might be that the utilities that they were calling about, they were not able to contact the agencies that were provided for them. So if they call back wanting other services, our notes and the information that we have gathered helps the next call specialist, so that, you know, you're not having to go over again with the same things. We've got that documented.
So you are keeping you're keeping a record of some sort,
Correct.
mainly just so you can know what help you've offered, what the issues have been. Now, so if somebody didn't want to give you their name, how then does that mean you can't necessarily help them because you don't have those notes, or?
No, we still help them, give them the same information we would the other person as best we could. It's just that if they call back again, nobody has that information to build on.
So there's no record of them necessarily in there.
Right.
How many people, do most people give you some kind of information so that you can keep those records?
Majority of people do, yes.
Because if you explain that to them.
Right.
Yeah, and our repeat call volume is very high.
Okay.
So we have especially
So,
in Muskegon County.
so certainly a lot of people are developing trust because you've shown caring and all of those things.
For what that is. And with 211, it has, there are several tenets in order to be a 211 service. and an accredited information and referral center is, and for 211, the call has to be free, or their contact with us has to always be free. It has to always be confidential, and they have the right to remain anonymous.
They do have that, right?
Yep.
Yes.
So those are kind of
And
those three
those are
tenets.
things that we would also tell them that, you know, that it is HEPA. And anything that we gather, we are not allowed to give out to anybody else unless they give permission for that to be shared.
So they're not going to worry that, say somebody called and they were an illegal immigrant, for example. They're not worried that that's going to get to authorities or something because you're not going to
No,
give that
we would never
information.
share information, even if, say, maybe someone is a client of an agency in Muskegon, and that caseworker has suggested to that individual that they call 211 and find out about food resources. If that caseworker were to call 211 to follow up and say, hey, you know, I'd like to know if John Smith called you, we cannot share that with him or her. It's confidential. So,
I had a call once that was very unique. It was one day a woman called needing help for her mother. She was actually living with her mother and asking for assistance for her mother's care. Gave me a lot of information, and we went through different agencies and services that might be able to assist. And she was pretty much the only sibling in the area that taking care of the mother. There were other siblings outside of Michigan, but they were not very helpful because they weren't here. Well, the sister-in-law the next day, and I happened to get the call, the sister-in-law called, and I just knew that because of the same name of the mother. So, you know, I had all the information from the first caller. I knew this lady like she was sitting next to me almost, and I had to repeat the whole call all over again with the sister-in-law, or, you know, for her mother-in-law,
Right.
giving her almost the same information, maybe building on it because I had insight to now the situation, but could not reveal that her sister-in-law had called the day before, which was really kind of a hard
yeah, it can be tricky to navigate.
confidentiality on that one was a little bit
You want to just
tricky.
go, oh, your
It's like-
sister-in-law.
it's like, no, did not do that, and kept both calls as if they had never called.
But that's a lovely,
That's just-
lovely problem to have, that actually there were two
Yes.
people who cared enough and knew enough to call.
Right.
Yeah, and who
Yes.
had the same call
Yes,
specialist.
yes,
You know,
and that's not
Yes.
always going to happen.
No.
And we should point out to our viewers that Call 211 is a service that's available 24 hours a day, 7 days a week, 365 days a year. It's not just in English either.
No, it's not. No, we use an interpreter service, a service called Language Line. And so if a caller calls in and either is not speaking in English to us or shares with the call specialist that he or she would prefer to speak in their, you know, first language, then we will place them on a brief hold and get an interpreter service. And the interpreter service also has the ability to determine which language the individual is speaking if we cannot discern what that is. Most frequently, Spanish is the language that we're using, but I know that one of our other call specialists, Marlene, had a call several years ago with a woman originally from Ukraine. And so I don't know if, you know, she at that time knew which language she was speaking, but was able to get an interpreter.
Now, how does that work if they call? Because when they call, I don't think I've called 211 for quite a while. Do I get a person right away, or am I going to get some choices on what to do?
You're going to go through the phone system. So we do have what is called an IVR, which is going to be an automated phone system that's going to ask the caller to put in their zip code. Once they have the zip code in, it will route them to our agency because there are 6 other 211 contact centers in the state. So it will route them to us, and then they will hear our options on the phone. Okay. So they will hear options, for example, for utility assistance, for food, for senior issues. Okay. And during tax time, there is an option because we do schedule tax appointments for the VITA program in Muskegon. They will hear that as an option. Okay. And when the Age Well and Senior Resources DTE Christmas dinner is happening in December, they hear an option for that, so we can make those appointments for folks. And then that allows us the ability to give specific skills to call specialists. So it might be that perhaps, say maybe Bonnie and Gail are just going to be taking tax calls. But someone else, if Sarah is also helping with phones, maybe she's not going to get the tax calls.
Okay.
So we have the
So it
ability
routes
to
that
assign skills
Oh,
that
wow.
way. Yeah, and kind of work and help manage our call volume.
Okay. How many people do you have on staff? It's just I know it's a small
Yeah,
agency.
yeah. We have a total of 6. 2 of the 6, myself and Sarah Johnson, our resource manager, are full-time. And then we have 4 call specialists, Bonnie, of which is one of those, and 3 others that are part-time.
Okay. And so there's a point in the day where the calls aren't being answered by your fabulous staff. They're going to
Correct, to
after all.
Griffin Place,
Okay.
which is the 211 contact center for Kalamazoo and several other counties in southwest Michigan. So we have contracted them, since 2005, with the exception of maybe a couple of years where we were using a different center. But otherwise, they have handled our after-hours calls.
And
many
all,
years.
and all the 211 centers have access to database so that they could.
Yes, we use a
that they can
statewide database, just like our phone system is statewide. We use a statewide database. So they handle our calls, they are seeing our county's information, and they also have access to any of our client records. So as Bonnie was saying, if John Smith has called, and maybe he's calling him back for some food options, Griffin has that option of finding his record and seeing what referrals we may have provided him in the past.
Okay, great. And I think that's important that you can do that, but I also want to really emphasize the importance of having these local staff members because you
Yes.
know your community.
Yes.
And so you might know that, for example, a 49441 is a pretty big zip code, and it's not just Norton Shores and Roosevelt Park, but it's part of
Correct.
Muskegon. And so you might know that referring somebody to a food pantry that shows it's in 49441 might not be the closest, because, for example, Tanglewood Park is in 49444, even though we're in Norton Shores.
Yes.
So your staff is going to know some of that. So it's really, I think, important that you've got those resources. Just that little added bit of
Yes,
knowledge.
it is. And even when you're talking with folks who maybe have to go in person to access a service, so kind of using the food resources again, oftentimes for pantries, some of them are by appointment, others it's show up and first come, first served. Well, if you have limited resources as a caller, we want to make sure that we are referring you to the places that are closest to you, and that either you have the gas money to get there, or if you're getting a ride, which of these do you think is most likely the place where your friend or coworker could give you a ride to? And being cognizant that even though a lot of services are kind of more centrally located than in other communities, it still takes time and money to get
Right,
to places,
right.
or that they're taking the bus, and we can look and see if it's on a bus stop for them,
Right.
and know
Yeah.
that.
So I think that's one of the things that I always emphasize when I talk to people about 211. Besides that it's available to everybody, it doesn't matter. It's not just for people who are struggling financially. As you
No.
said, there's all kinds of things. But when you call, you're asking for more than just what they called for, right? Because
Yes.
so sometimes you can call and you might need utility assistance, and it might be a point in the year where that money isn't available because the True North, which is usually the one that gets the money for our area, does run out of that funding at some point, depending on how hard of a winter we've had,
Yes.
especially. But then you can ask them questions to find out if there are other ways that you can help alleviate something that would allow them to shift their limited resources, perhaps. So I think it's really important that you're asking those other questions, and that it's not just because you're being nosy, but because
No.
you might be able to help. Or if somebody calls presenting with a food insecurity issue, chances are pretty good there's something else financially
Yes.
going on. And it could be health, could be medical. Medical bills, oh boy, they're just really tough for a lot of people.
It
So-
is, and we do not ever want to assume why an individual is calling us. And regardless of why they're contacting us, there is no judgment on what their need is or why they have the need. Even if it's something that they have repeatedly maybe called us for, we're always glad to talk with them and to share what information we have and help them access that service. And part of what we do is also explaining to people when a service isn't available or when they're not eligible for that. So like you said, if the utility funding runs out, that certainly happens frequently, unfortunately, especially in the summer and the early fall months. But we have people who might be requesting a service that for whatever reason doesn't exist yet in our community,
Right.
and then can provide all of that statistical data about where calls come from, what the requests were, and where we could refer people, what services we could refer people to help for, and which services we couldn't,
Right.
and can document that.
It's a tremendous resource for other organizations, especially nonprofits in the community, to know that.
Yes, and we're always glad to share that data.
So, because we could talk about this for a lot longer,
Yeah.
and we're already getting close to our time, faster than usual, but let's talk about other ways besides calling. Not everybody likes to call. What other ways, are there other ways that they can get in touch with you?
Sure. Right now, we do have email availability, and so that email from our website, individuals can access that. We do post information on our Facebook page. And
Like
so,
your Facebook page.
Yes, please. And we do respond to messages that we get through that. We have the ability right now to text out information to individuals who have called us. So, for example, if we're giving referrals again for utility assistance, we can text what those referrals are. And I've overheard Bonnie doing that a lot lately. And hopefully by early summer, we will have the capability of receiving text messages in for help. And then also we do take walk-ins as well. So if individuals do come to, we're located at Central United Methodist Church. So when we were housed with Tanglewood, or at Tanglewood, we had a much higher walk-in volume than we do now. But if anyone would prefer to have a conversation in person, they are always willing to come. So the church is actually only open Monday through Thursday. And so between the hours of, I would say, 8 to 4:30, we'd be glad to talk with anyone who prefers to talk that way in person.
So let's talk really briefly about, it's a challenge to keep information up to date. How do you do that?
That falls to Sarah Johnson, who is our resource manager, and we, as an accredited information referral center, are required to ask each agency in our database to do a full update of their information. So we are contacting them. A lot of that, it's done by email. It's however the agency prefers it, but at this time, most people are getting it by email,
Right.
completing it, sending it back. Our software system also has the ability to do updating where it is generating that email, and then they're logging in with a link and making changes to that. They come back to Sarah, she can review them, and then puts the changes directly into the database. But she is doing interim updates to agency, program, and service information all the time.
Because you're out, the two of you are out at meetings as much as you can
Yes.
be, getting information, because things change all the time.
Yes.
And so I think that's one of the things for people to understand. 211 is only as relevant as the information you get.
Yes.
And then sometimes if an organization doesn't update, that funding's gone, or that staff person's gone, or we don't do that program anymore, you won't necessarily
we
know
don't
that,
know.
but going to meetings helps with that.
It
when you
does,
can.
yes, and that we are always open to input, even if it's from a caller who's telling us, hey, I got this information from you and I called and they're not doing that anymore, or from agencies themselves calling us and letting us know, hey, we've got changes. We can make those changes on the phone, they can email them, they can fax them, anything like that.
So, for example, with the senior millage money that's
Yes.
now out there, that's incumbent on senior resources as the administrator to make sure you've got that, and then for those agencies that have the programs to make sure they let you know if funding is running out.
Yes,
That kind
and
of
that information is trickling in, and we are glad to have it.
Well, we're glad to have more of that. So we are running out of time very quickly. But again, we just really want to emphasize it is for anybody. It's not just for older adults. That's why I was excited to have you ladies on the program, because we can never tell people enough. Call 211. I end every single program every month with the number of the agency. And if you can't remember that, call 211. Well, this time, I'm just going to tell you to call 211.
Yes, please.
211. You can do it on cell phones
Yes, you
and all of
can.
that. And that's changed a lot over the years, because there was a time we had to give out a different number.
Yes, and
that-
now there is access.
access to that.
Yep.
So call 211 if you need anything 24 hours a day. Ladies, thank you so much for joining me.
Thank you, Lisa.
Remember, 211. Thanks, and we'll see you next month.